Today, we'll look at 8 indicators of a mini stroke in elderly patients experiencing transitory ischemic attacks. Did you know that small strokes are prevalent in the elderly, and that your loved one could be misdiagnosed if the symptoms are not appropriately identified? An ischemic stroke occurs when the blood supply to part of the brain is blocked or reduced. This prevents brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Another type of stroke is a hemorrhagic stroke. It occurs when a blood vessel in the brain leaks or bursts and causes bleeding in the brain. The blood increases pressure on brain cells and damages them. A stroke is a medical emergency. It's crucial to get medical treatment right away. Getting emergency medical help quickly can reduce brain damage and other stroke complications. The good news is that fewer Americans die of stroke now than in the past. Effective treatments also can help prevent disability from stroke. According to the American Stroke Association, around 240,000 persons in the United States suffer a transient ischemic attack each year. Furthermore, approximately 1 out of every 5 persons who have a suspected mini-stroke will get a stroke within 90 days. Many strokes and transient ischemic episodes are only transitory. Blockages of blood flow to the brain. The clot usually resolves on its own or becomes dislodged, with symptoms often lasting less than 5 minutes. However, it can be regarded a warning stroke, signaling a potential significant, indicating the possibility of a massive stroke soon in order to comprehend mini-strokes better. First, let's look at the 2 primary strokes ischemic blood CL clot types. This type, which affects less than 90% of stroke victims, is the most prevalent and happens when a blood vessel becomes clogged or obstructed, preventing blood from getting to the brain. Hemorrhagic bleed. Mini strokes and major strokes differ in several ways. A major stroke can result in permanent disabilities. This type affects slightly over 10% of stroke patients and is caused by the rupture of a blood vessel in the brain, leading to blood accumulation and compression of brain tissue. It is important to remember that a mini stroke is a medical emergency and should not be disregarded. Usually, a microstroke only has transient side effects. Another significant distinction is that the symptoms of a major stroke can linger up to 24 hours, whereas those of a mini stroke typically subside within a few minutes. Nevertheless, the distinction between a major and a mini stroke typically becomes evident only after the event, so it's vital to understand that these are not the only kinds of strokes. Silent strokes are very common, particularly in the elderly. They get their name from the fact that many patients are unaware that they have happened because they frequently do not exhibit obvious symptoms or result in an abrupt loss of function. This may occur because the stroke did not damage certain parts of the brain, could make up for those who are impacted. The signs and symptoms of a cerebrovascular accident differ based on the affected brain region. So make sure to watch our video to learn how to identify these symptoms fast and assist your loved ones when needed. Number 1, dizziness or balance problems until the end. Dizziness can result from a diminished blood supply to the back of the brain, which puts balance problems and dizziness among the most prevalent early signs of a small stroke. If you experience dizziness or vertigo. If there's no obvious reason, it's critical to get in touch with your doctor very away. 2. Numbness or drooping. In a mini stroke, when the brain lacks blood and oxygen, sensory processing can be affected, affecting muscles, nerves, and skin. Sudden and unexplained occurrences of numbness, weakness, or drooping in the face, arms, or legs are a distinct sign of a stroke. The symptoms of a stroke usually only affect one side of the body, which might cause an uneven smile. Strokes usually affect one side of the brain. Abnormal facial expressions when eating or speaking. Drooling limb weakness, having trouble moving or raising limbs, loss of equilibrium or coordination, difficulties walking, difficulty speaking, and problems perceiving beyond the symptoms that are readily apparent. Strokes can also damage speech and other cognitive skills. When the blood and oxygen supply to the brain is interrupted, it can affect the muscles of the mouth, including the tongue and lips, which are vital for speaking. Due to disruptions in the brain impulses that regulate speech activities, this could lead to abnormal speech patterns. Dysarthria, a frequent speech problem associated with strokes, is characterized by sluggish, indistinct, or incomprehensible articulation, which commonly occurs as an early symptom of a severe stroke. Aphasia is characterized by problems with language processing and understanding that result in the use of fabricated words or incomprehensible language, as well as an incapacity to communicate successfully. AIA also causes significant physical difficulties, especially to the tongue and lip muscles, which might alter the way speech is pronounced correctly. Strokes can cause visual impairment. As a result of the stroke's effects on the brain's visual processing areas, people may have trouble recognizing faces, objects, and visual spatial awareness. For inability to concentrate, some patients have trouble focusing after having a small stroke. This problem is brought on by the brain's decreased oxygen and nutrition supply, which can disrupt normal brain function and, as a result, may have an impact on focus and general brain health. 5 misunderstandings individuals who have had a mini-stroke prompt treatment is essential, as it can reverse these symptoms if given immediately. However, if left untreated for an extended period of time, initial confusion could escalate into more severe cognitive issues, including significant memory loss and dementia. The onset of stroke-induced confusion can be abrupt, may exhibit signs of disorientation, frustration, or confusion. They might have trouble in recognizing their own identity. Before we proceed, we kindly ask that you like this video. Interrupting existing activities frequently results in the individual being unable to think effectively, communicate, or understand spoken information. To ensure that you don't miss any of our educational films and health advice, subscribe to our channel and enable notifications. 6 really bad headaches. Having a severe headache can be a common sign of a small stroke. It can be difficult to distinguish these headaches from migraines because they can last for hours or even days. If you experience a headache that is out of the ordinary for you and lasts longer than 4 hours, you should consult a doctor right away. A headache related to a stroke is characterized by abrupt and excruciating pain, differentiating it from a migraine, which usually begins as a throbbing pain that becomes worse over time and sometimes comes with accompanying symptoms like tingling skin and visual auras. 7. Fainting or synopsis. A transient disturbance in the brain's blood flow causes syncope, a condition marked by an abrupt loss of consciousness and muscle control that usually lasts less than 5 minutes. While consciousness can sometimes be restored on its own, other cases necessitate immediate medical attention. A significant episode of fainting, particularly if it is followed by other symptoms like weakness. How to identify mini strokes. Remember to act fast when experiencing signs of mini strokes. The National Stroke Association recommends using the FAST acronym as a guide for identifying warning signs and knowing what to do. F is for face. Ask the person to smile if one side of the face droops. It's a warning sign. A is for arms. The person lifts both arms if one arm drifts downward or is difficult to move. This is a warning sign. S is for speech. Request the individual to repeat a simple sentence if their speech is slurred or sounds unusual. It indicates a warning sign. T is for time. If any of these warning signs are present, it's critical to call 911 immediately and get the person evaluated at a hospital emergency department for a possible stroke or mini stroke. How do you know if you have had a mini stroke? Let's discuss how to determine if you've experienced a mini stroke. Although mini strokes may not cause permanent damage at the time they occur, seeking medical attention is crucial, regardless of the severity of symptoms, to identify the possible cause of a mini stroke. Medical professionals often perform diagnostic tests such as computed tomography or magnetic resonance imaging scans of the brain and cord arteries. Here are some of the risk factors of mini strokes for the elderly with hypertension: high cholesterol, obesity, smoking, diabetes, and an inactive lifestyle like most other. The risk of mini strokes increases with age. However, these risk factors are often manageable, providing opportunities for prevention and improved health outcomes. How to prevent mini strokes. There are several strategies to prevent a mini stroke as recommended by the CDC Centers for Disease Control and Prevention. These include controlling and treating high blood pressure, managing cholesterol levels, avoiding smoking, and the regular use of aspirin under medical guidance. It's important to note, however, that aspirin should not be used to treat an active stroke instead. If you or a loved one experience a mini stroke, it is critical to seek immediate medical help and go to a hospital. A patient's overall health condition often plays a crucial role in their recovery. Generally, the better your health, the more favorable your recovery. Prospects for ischemic mini strokes. Patients may be given medication to dissolve the blood clot or to remove the blockage that is obstructing blood flow. As we age, health risks, including the risk of stroke, tend to increase significantly, but with proper care. By including balance exercises for seniors and attentive health management, you can take important steps toward maintaining your well-being and achieving peace of mind. Remember to contact your doctor if you experience any stroke symptoms in such situations. The most crucial action is to seek medical help as quickly as possible. Your healthcare professional performs a physical exam and a neurological exam. Tests of your vision, eye movements, speech and language, strength, reflexes, and sensory system are included. Your healthcare professional may use a stethoscope to listen to the carotid artery in your neck. During this exam, whooshing sound called a bruit may mean that you have atherosclerosis, or your healthcare professional may use an ophthalmoscope. This instrument looks for cholesterol fragments or platelet fragments called emboli in the tiny blood vessels of the retina at the back of the eye. You also may be checked for risk factors of a stroke. These include high blood pressure, high cholesterol levels, diabetes, and sometimes high levels of the amino acid homocysteine. If your healthcare professional suspects that a narrowed carotid artery in the neck may be the cause of your TIA, you may need a carotid ultrasound. A wand-like device called a transducer sends high-frequency sound waves into the neck. The sound waves pass through the tissue and create images on a screen. The images can show narrowing or clotting in the carotid arteries. Magnetic resonance imaging, MRI, or magnetic resonance angiography, MRA. These tests use a strong magnetic field to create a 3D view of the brain. MRA uses technology similar to MRI to look at the arteries in the neck and brain, but an MRA may include an injection of a contrast material into a blood vessel. Echocardiography. This test may be done to find out if a heart issue caused fragments in the blood that led to a blockage. A traditional echocardiography is called a transthoracic echocardiogram, TTE. A TTE involves moving an instrument called a transducer across the chest to look at the heart. The transducer emits sound waves that bounce off different parts of the heart, creating an ultrasound image. Or you may need another type of echocardiography called a transesophageal echocardiogram, TEE. A flexible probe with a transducer is placed into the tube that connects the mouth to the stomach, known as the esophagus. Because the esophagus is directly behind the heart, a TEE can create clearer, detailed ultrasound images. This allows a better view of some things, such as blood clots, that might not be seen clearly in a traditional echocardiography exam. Arteriography procedure is used in some people to get a view of arteries in the brain not usually seen in an X-ray. A radiologist inserts a thin, flexible tube called a catheter through a small incision, usually in the groin. The catheter is guided through the major arteries and into the carotid or vertebral artery in the neck. Then a dye is injected through the catheter. The dye allows the arteries to be seen on X-ray images. If we talk about medicines or treatment, once your healthcare professional learns the cause of the transient ischemic attack, the goal of treatment is to correct the issue and prevent a stroke. You may need medicines to prevent blood clots, or you might need surgery. Several medicines may lower the risk of stroke after a TIA. Your healthcare professional recommends a medicine based on what caused the TIA, where it was located, its type, and how bad the blockage was. Your healthcare professional may prescribe antiplatelet drugs. Medicines make a circulating blood cell called platelets less likely to stick together. Sticky platelets begin to form clots when blood vessels are injured. Clotting proteins in blood plasma also are involved in the process. If you enjoyed this video, please give it a thumbs up and remember to share it with your loved ones so they will also know the 8 signs of a mini-stroke that cannot be ignored. Also subscribe to support our growth and hit the notification bell so you don't miss out on our next video. Now, we're curious to know, did you know about these signs of a mini-stroke? Share with us in the comments below before you leave. You may also find some other helpful videos popping up on your screen right now. Thank you so much for watching. See you in the next video.